part of my job is preparedness, and so my job, which is slightly different than emergency management, is that although we work with emergency management, my job is slightly different in that under FEMA, we have different emergency support functions. I function under emergency support function number 8, which is public health. And so anything that falls under ESF 8 basically falls to us. And so my job is to kind of work with all of the long-term healthcare facilities, dialysis centers, clinics, things of that nature, dental practices, medical practices. And so although I went around before COVID and kind of gave them my contact information, this is what we can do for you, gave my card. Most weren't really interested because most didn't believe that anything could happen here. Now that COVID has happened, now everyone's become kind of my best friend because they found out where they can get resources at. So what I provided for them was basically gap resources. And so gap resources are a little bit of PPE in the interim until more PPE can come in, whether that comes from their vendors or the larger amount of PPE that was being provided by the state. And so essentially they would provide a resource request. So they would provide a 213 resource request as a FEMA form. They would provide that to me. We would evaluate what we had. And then based on that resource request, we would figure out what we could provide for them. And then what we did not have, then we would send off to the state, and the state would then try to accommodate them based on what obviously they had as well. And so a lot of the administrators or directors of nursing from these long-term healthcare facilities soon found out the value of preparedness. As we started to wind down last summer, after we finished the first wave of COVID, before we had the second wave, we started to see that the disposable PPE was going to be back in high demand again. Even though we were in better weather, the need for PPE, we needed to go ahead and replenish. Unfortunately, the cost was still significantly up there. So I looked at strategies to ensure that everyone had more sustainable PPE. And so I looked at gowns, because gowns and masks were the two biggest items that most long-term facilities did not have. And so we found respirators that could be reused for longer periods of time, and gowns that could be reused over and over again, and it could be laundered. Although the costs were more considerable than a disposable gown or a disposable mask, you get a much greater use out of these. So when you have a gown that you have to pretty much throw away after a single day, you have a gown that you can wash and reuse at least up to 100 times. So we had many agencies that were in dire need, and we didn't have the gowns, and even the state sometimes did not have the gowns. We had to get creative. There was times they were using garbage bags just to protect their staff. So now that we've winding down, we're after we've had our second phase of COVID, I've sent out an email kind of re-emphasizing, please reconsider more sustainable options. And if that's not something that your facility can do because you're a part of a larger corporation that can't do that because of their purchasing options, please consider stockpiling what you can. I just opened everyone's eyes to the possibility So, prior to COVID, most of my time revolves around. So I get paid off of a Homeland Security grant. I am a contractor, so I work for the county, and so there's certain deliverables that I have to meet in order to get paid through the grant. As long as those deliverables are met, then I get paid by the grant. So part of that is writing plans. Part of that is making sure that we are interacting with our community partners, which would be those individuals such as the long-term health, the dialysis centers, the medical dental clinics, engaging so that there's resilience within the community, that we can all work together when these things transpire. So most of it's that. There's certain things that I have to complete certain trainings, and then other times we'll collaborate between local health departments. So within the district, both Lake, Porter, Newton, Jasper, and LaPorte counties all come together once a month generally, and we're working out any obstacles that we foresee within the district. We work with our state partners to try to work on those obstacles that we can mount a more sufficient response, and then that way we can incorporate that into our plans. Just prior to COVID, the Strategic National Stockpile Mass Prophylaxis Plan was at least 8 years old. Most plans have to, have a major rewrite every 5 years with at least a revision, a look-see through at least once a year. So when I came into, it was due for a major revision, so I rewrote it. About the time that I finished it, COVID happened, and so we implemented that plan right away. So it's funny because the state said, dust off your SNS plans, and I just completely rewrote it. So we implemented that plan, and that's actually the plan we used when we went out to the Porter County Expo Center, because that's what we did. We mass prophylactically, immunized everybody. The Strategic National Stockpile is the PPE that we received and that we initially did before we actually started vaccinating everybody. So Right now, I'm working on a all hazards emergency operations plan, which is one of the deliverables. So we look at um, basically anything that could affect public health. We look at chemical, we look at biological, which is what we dealt with COVID. We look at radiological. We do have two nuclear plants up in Michigan that we're in the ingestion pathway, so we have to factor that in. So those are all things that we look at when we're writing these plans. How will we respond? What mitigation strategies? What's going to be our response strategies if something were to happen? You know, in any of those instances, we do have memorandums of understanding set up with certain key locations within the county, mostly where there's higher population counts, so that we can go ahead and provide those strategic national stockpile medications. So if there was a chemical release or a biological release or a radiological release, that we can, if there's a prophylactic medication or antibiotic or something that would counter that agent, we can basically take care of everybody within 72 to 96 hours.